I'm Raquel Goldhardt, retina and uveitis specialist. This is not just about getting a translator. How are you doing regarding the way you communicate with your patient? Are you making them feel that he or she are the most important part of the whole interaction? Because this is what really matters. Provide them the sense of belonging and making him or her feel valued. And an environment that's welcoming to people of all languages starts long before the doctor-patient interaction. It starts with the people on the phone, making appointments, prescriptions, follow-ups. Then you listen. Don't interrupt. 1, learn a few polite expressions. A simple good morning or a thank you in the patient's native language. 2, the shortened explanation, the better. But do not withhold information. Do not give direct advice. Do not make decisions for your patients. Let them decide. Look at the interpreter. Stay engaged while he is translating your words. Don't look through charts, talk to others in the room, stare out the window, speak in full sentences, and avoid family members and friends, translators. Become a culturally competent doctor. Be culturally sensitive and appreciate the differences.